Hello everybody, it's Kip Teitsort with DT4EMS and an episode of Chronicles of a Culture Changer that I want to call Self-Defense Pharmacology. Now, contrary to what you might be thinking, this will have absolutely nothing to do with the actual distribution of a drug or using a drug. Instead, what I really want to show you is how the same critical thinking skills that apply to pharmacology would actually apply to patient restraint and self-defense. If you think about it, when we talk about pharmacology, we know there are a ton of laws and rules that govern the use of any type of controlled substance. Things about when we're allowed to use them, policies and procedures and checks and balances and all kinds of strict documentation of any time we use something or distribute it. So when you think about it, healthcare professionals get a critical thinking skill by indications, contraindications, dosages, and routes of administration. So when you think about it, this art form that we have for critical thinking skills is indications. When do we want to use this drug? Contraindications. Whoa, when should we not? Dosages, well, how little or how much do we give of something? And then the route of administration would be, how do we give it? Is it, by IV? Is it IM? Is it drip? Is it an updraft? These are all important when you think about the critical thinking skills of drugs. Now, the critical thinking skills, we really build them initially through training, then there's experience, and then continuing education as things change. Well, we know there are some real hazards that go along with distributing medication on the job because we're human and humans make mistakes. As you can see in the image here, there's one from July 3rd where they're talking about an error in the hospital causes somebody to die because they gave them the wrong medicine. We know that this goes on quite a bit. And because, again, we're human, right? So the FDA actually says that there's like 1.3 million injuries per year based upon medication error, and at least one a day. This exposes us to, obviously, civil litigation and, loss of the public trust, whether it be through social media and the mainstream media. Well, the question I have is, if there are 1.3 million medication errors a year, do 1.3 million healthcare providers get fired every year? Or does the agency offer a remedial training because they, oh my gosh, they can't operate without you? Or is it because they want to reduce the number of zeros on the back of a check because medications are a known hazard? Well, you can answer that one yourself. So why then, when it comes to something like using force, are employees fired immediately if there's an error that's made in good faith, as if, one was made during medication errors, if they were under stress, again, as one would occur during medication errors, if there's no or improper training when it comes to this using force? Now, again, I'm not talking about punitive usage. Where a staff member should be fired and or prosecuted for using force. I'm talking about mistakes made when someone is attacked on the job. So consider this. Law enforcement sees the use of force as very high liability. And since they recognize it is very, very high liability, there's a lot of training that goes on with this. There's policies and procedures. There's laws. All this stuff that goes on with the law enforcement use of force. But wouldn't you think that that's about the same when we talk about medication in healthcare, that there's high liability? We've got policies and procedures, laws governing, tons of training. Now you're starting to see how I'm drawing this parallel. So let's look at law enforcement for just a moment. When it comes to the use of force, there's the initial training. So you've got, whatever the form of police academy, and then there is continuing education that's required for recertification. There are laws that govern the use of force. For instance, when to or when not to take a person into custody. So if you've got a local, a local city ordinance, you've got a state statute, or there's some form of, a federal law that's in place that says if a person has committed the elements of said crime, or they haven't made enough of the elements to make an arrest or use any force right then and there, then, so that's the when to or when not to, but then you have options, which would be the how to, or by which means. So what level would they use? Would they be, empty hand? Is there a taser? Is there a firearm? So now you're starting to see even more how these two high liability subjects parallel one another. Well, when you think about self-defense, it also has some accepted rules that has absolutely nothing to do with work. We're talking about the question of whether or not the use of force a person used based upon size, sex, skill level, fatigue, numbers involved, and was there any arming of either person. So there's a lot of questions that go into, was the person's use of force reasonable? Again, has nothing to do with work. We're talking about self-defense in general. So if you're not careful about this, sometimes people are so worried about violating a policy that they don't realize that they may be in actually violating a law. So be careful. Violation of employer policy is definitely not the same as violating some form of a law. That's not for me to discuss. That's for you and your attorneys to discuss. Now, so here we go. Violence in medicine, it's an epidemic, whether it's the Emergency Nurses Association, the National Association of EMTs, OSHA now fining hospitals, and just now recently within the last couple of weeks sent out some questionnaires to the pre-hospital side. But you're now getting risk management and work comp insurers and underwriters really starting to take a look at violence going, oh my gosh, we had no idea it was this much of a problem. Part of this is because violence is now starting to be recognized as the hazard that it is. And people are starting to now report violence where for so long they didn't talk about it at all. We're still nowhere near where we need to be with actual reporting, but we're making progress. So if violence in medicine, think about the problem we see here. So if violence in medicine is a known or recognized hazard, but at least it should be because of the frequency of occurrence, and that staff are human and humans make mistakes, then flip that you've got critical thinking skills are absent, meaning staff are penalized anyway for just acting without any training or inappropriate training or based upon their previous experience. What if you had a guy who was a previous boxer and he was, say, a Marine and gets out of the Marines, decides to be a nurse or a paramedic, and if he hasn't been told what is or what is not reasonable, someone grabs him and he handles his business, well, now he gets in trouble because nobody said what was or was not reasonable for use on the job in medicine. And then, of course, there's no continuing education present. So again, there's no real critical thinking skills. And so what happens? Well, if a staff member uses force, and that doesn't happen all the time, but we have a lot of stuff that we're working behind the scenes where, you know what, an employee does something that is 100% completely reasonable in a self-defense action, and the employee gets fired, and then worse, some have even faced their licenses being suspended or revoked. Well, here's the problem. It all goes back to culture. When you're not addressing it through training, the vicious cycle just keeps continuing. So you can give somebody a medicine at work and kill them and probably not get fired. But if a person attacks you and you do something as simple as push them away, they may turn around and try to fire you, and you may lose your license. Does anybody not see how this is an issue yet? So let's think about it like this, self-defense pharmacology. Even if you're not training regularly at your facility right now, this is a little tip that I can give to you that will really help you, whether you're an administrator or a frontline staff member, and it comes down to using force on the job. The use of force in medicine is unique. No other group on the planet, not police officers, not cab drivers, not a woman walking in a park, nobody on the planet has to go, am I dealing with a patient or a criminal attacker before I attempt to use any type of force? So that's a very, very unique situation that we're in, and that requires a very unique set of skills and critical thinking skills. If you think about how the police train for use of force and we train for pharmacology, they're very, very similar to one another in the critical thinking of when to use it, when not to use it, how much to use, and how to use it, because there are laws and rules that govern both of us. So in medicine, let's look at it like this. There are laws and rules that govern the use of force. When you think about it, when are there actual assaults in healthcare? Because that is now in many states, there are laws designed to protect the healthcare provider, but we all know that penalty isn't protection, but it does prove there's a problem. But then you have actual general self-defense laws. If you think about it, if you are following strict documentation of any use of force, which would mean you make a police report. If you're attacked and you defend yourself, you make a police report. This gives that system of checks and balances for use and distribution just like it would for a drug, because then it protects us in civil, because if we can get that person to plead guilty or we win the criminal, I mean, it's much more difficult for them to sue us civilly when we win a criminal case against them. Then you have agency policies and procedures for the use and distribution of the use of force, whether it be through patient restraint or self-defense. So you have training, documentation, but then more importantly, and a lot of this stuff is post-incident support and review of how we can make sure that everybody is safer, healthier in the future. Then think about it. So what may be reasonable for a woman walking in a parking lot or a man outside of a bar, if they're attacked, may be different than that of what happens inside of a hospital or on some form of an EMS scene. Because when you think about it, I need you to get this, guys. Could a healthcare professional be grabbed similarly by a confused patient that is hypoxic, hypoglycemic, hypovolemic, any of those that you want to go along, again, septic, any of that, the same way that a drugged or drunk individual could grab them with criminal intent. Meaning, if you were in a split second, if you think of it, could you turn a corner as a healthcare provider and be grabbed around the throat by an 80-year-old nursing home patient who is confused because they're hypoxic or glycemic, or turn that same corner and be grabbed by a guy who's 28 years old and high or intoxicated in some form, grabs you around the throat with criminal intent? You see that we would have to respond to each of those differently, so technique alone is dangerous. So when you think about self-defense pharmacology, I'm asking you to use it and to approach your use of force training or your critical thinking skills with the pharmacological mentality in mind, meaning think of indications, that is when to use force. Contraindications, when should I not use force? Dosage, how much force should I use? How little force should I use? And then the route. How would I use force? Would it be through an empty hand? Is it an escape? Is it a restraint type of technique? I mean, that's how you really look at this. So when you see it all in the big picture, it really does become an art form. The self-defense in healthcare is so much more than just a physical skill. You actually have to win more than just the skill or the incident itself, because there's 4 areas you have to win: the mental aspect, the street or the skill aspect, the media, meaning the real media, and which is mainstream, and then the social media, and then the courts. We've got the court of public opinion, and we've got the legal courts that we have to win based upon reasonable. So was this a patient or was it not a patient helps us win these 4 areas, but not unless you approach it the appropriate way. So if you're going to be better prepared, you really need to do it like you would a pharmacological intervention. The right training is going to give you those critical thinking skills. So again, approach it with indications, contraindications, dosage, and route. If you thought about it the exact same way, that is the use of force. If you think about it, you train for it the same way you think about and train for pharmacological intervention, you, my friends, will be safer on the job, and you will stand a much better chance of winning should you find yourself placed into that situation. Now, again, a win for us is the refusal to be a victim of criminal activity or refusal to be beaten up. So a win in a fight means you beat someone up. Winning in self-defense means you simply refuse to be beat up, which could be I back away, I don't get involved to begin with, all that sort of stuff. There's a lot more that goes along with this, but this is one quick way to give you an understanding of self-defense pharmacology. Thanks for watching. I'm Teitsort, and we'll talk to you soon.